Hi, today we will be interviewing Dr. Jessica Toma.
Okay, so first, could you briefly introduce yourself?
Sure. Hi, I'm Dr. Jessica Toma. I am the owner of Pennington Family Chiropractic. I have lived in New Jersey for a few years now, and I've been the owner of this office for 8 months. So it's a new endeavor for me. The practice has been around for over 40 years. It belonged to a family of chiropractors, and they decided to pass it down, and I'm very fortunate and lucky to be the person that ended up buying the practice from them. So yeah.
And for people who may not know, can you describe what a chiropractor is and what they do?
Sure. So a chiropractor is basically, we're not medical doctors, but we are doctors of chiropractic. And so what that means is we focus on the spine and we focus on spinal misalignments. We also look at your nervous system. So there are nerves that innervate to your muscles, into your vital organs. And so we go into the spine and we align and make sure everything is lined up and working perfectly. Basically, your brain sends signals through your nerves and your nervous system to your body, to your muscles, your organs, all of that stuff. And so we make sure that the signals from your brain are getting sent to your muscles and to everything in your body, and there's no like roadblocks or backups, basically.
Do you guys also prescribe medicine or no?
We do not prescribe any medication. Yeah.
And what was your path to becoming a chiropractor?
Great question. So I originally wanted to do something with healthcare when I was growing up. I knew I wanted to help people. I just didn't know how and in what capacity. While I was in college, I was studying pre-dental. I shadowed a dentist, and I hated it. I was like, this is kind of gross. And so then I looked into pre-med, and I shadowed doctors, and I did all these different things, and I decided I did not want to prescribe any kind of medication. So I started looking into physical therapy. I shadowed a PT, and I thought, wow, this is a lot of paperwork. This is not for me. Wanted something more hands-on. So that's when I discovered chiropractic care. I like that you get to physically touch patients and work with them with your hands. Yeah.
And during college, what were some of the courses you took that you really enjoyed?
Oh, good question. So I took a lot of biomechanics and body movement classes. So exercise physiology, anatomy and physiology, as basic as it sounds, it's so interesting. The human body is just like a beautiful creation.
Yeah.
So those kinds of science classes, but it was like college PE is what we called it, which was fun.
And now, what does a day in your life look like? And what are some of your daily tasks?
Okay. Do you want a play-by-play?
Yeah.
Okay. So I wake up pretty early. I wake up at 5:36, get up, have my coffee, sit by myself for a second, and I get ready to head into the office. We start seeing patients at about 8 o'clock. So I get into here around 7:30, 7:40.
Okay.
Just kind of prep for the day. We look at the patient schedule. We look at who's coming in. We review x-rays if we need to review x-rays. We review patient charts, insurance, all of these fun things that nobody tells you about in school. And then we see patients until 12 o'clock. We have a 2-hour break, take some lunch, finish up notes, finish up paperwork. Sometimes I have meetings for administrative stuff. And then we start seeing patients again at 2, and we wrap up around 6 o'clock. And then I head home and I have dinner. And I just hang out with my husband, go on a walk, relax. And I go to bed at 9:30.
That's good. That's pretty
Sleep really early, but I also wake up early.
Yeah. And what are some of the things that you do to treat patients?
So we have new patients when they come in. We take x-rays. We look at their x-rays. We look at their spine specifically. Sometimes we'll take x-rays of knees, elbows, whatever it may be. And we look at those x-rays and we say, okay, you have arthritis. You have this, you have that. And then we tell them, okay, we come up with a care plan, a treatment plan for them. We say, we want to see you a certain amount of times each week or a certain amount of times each month. We adjust them. So we do some muscle work with them. We do some therapeutic exercises, some stretches to warm them up, and then we adjust them. And then we tell them, okay, we'll see you whenever we tell them to see them again. next. So that is kind of one of the main things that we do with patients. We give them exercises to do at home, and we look at their sleeping patterns, we look at their habits. And for example, if somebody has multiple monitors on their desk, we say, okay, you need to face the monitor and not torque your neck a little bit. Yeah.
And do patients usually get referred to you, or can they just walk in and schedule appointments?
So it's both. We have some medical doctors that refer to us, PTs that refer to us. Then we just have people that say, hey, I drove by and I want to come in for an appointment. So you can walk in with no referral. Yeah.
And what would you say is like the most challenging part of your job, and what's the most rewarding part of it?
Okay. The most challenging part of my job is when I like to problem solve with patients. And so when someone comes in and I say, okay, my back is killing me on the right side, and we can't figure out why, or they're not getting better in the time that we expect them to. Everybody is unique. Everybody was created differently, and everyone's problems will be different. So you can't treat every single patient the exact same way. Nobody will get better. And so you have to create a unique plan for patients. And sometimes certain patients just take a little bit longer, or they take a little more intervention than others. So the slow progress can be really challenging sometimes because you want them to get better. And then something that's really rewarding is when you adjust a patient or you treat a patient, and then they finish their care plan and they say, I feel significantly better. And they're also taking what you've told them, the stretches, the exercises, and they're applying it in their day-to-day life outside of the office. That's always really nice too.
It's really nice.
Yeah.
And I was wondering, like, what makes your profession unique compared to other medical or healthcare professions?
So we like to say that we are nervous system doctors, right? I think the only other doctors that can say that are maybe neurologists or something. I don't know. And orthopedic specialists maybe. But chiropractic care is very unique because you don't go to medical school, but you get all of this training in school, very similar the first year and a half of school to medical school. We don't take as much pharmacology. You take one pharmacology class, and then you focus on nutrition, and you focus on holistic and natural healing. Everything is evidence-based and science-based, which is awesome, but you get to tell people we're going to help heal you as natural as possible. So I feel like that's always really a blessing to be able to help people heal from the, inside out. I also like that we don't prescribe medications, but there's a time and place for that. There's a time and place for surgery. There's a time and place for meds. And I like to co-manage. And so when we can't help somebody, we can refer to somebody else. I love that about healthcare, that we can all work together to help people.
That is nice.
Yeah.
What made you interested in like more natural methods in treating people?
So I saw one of my family members get into a car accident, and the first thing that was recommended was surgery, and the first thing that was recommended was medications and very, very heavy drugs that you can get addicted to. And the surgery is like your standard of living afterwards is really just like rough and tough. And so this person decided to try a holistic route, a natural route. And so watching them go through that and actually get better and not need the surgery and not need to take these medications. Yes, it was a lot more difficult and it was a longer road of recovery, but they don't regret it. And watching them heal made me decide I want to do that. Yeah.
Okay, so throughout your journey to becoming a chiropractor, what values or skills did you develop or learn that has really shaped the way you approach patient care today?
Wow, you are so philosophical with your questions. So something that I learned is having discernment. So you go to school for a really, really long time. You graduate and you feel like, okay, what on earth did I just learn? Or like, how do I apply this to day-to-day life? How do I apply this to patients? You know that like a textbook case of sciatic pain, for example, walks into your door and you're like, okay, this is how I was taught to treat them. And then there's times when you think to yourself, well, could it be a disc herniation? Could it be this? Could it be that? And so using your discernment to know how to treat patients, and also using your discernment to know when not to touch patients. So there's certain cases where we see a patient comes in, they think a chiropractor can help with it. We say, no, actually, you need a medical doctor, or actually, you need physical therapy. So having the discernment and not just saying, they came to me, I'm the specialist, and I know everything. It's okay to not know everything. It's okay to say less is more sometimes, and it's okay to, like, I guess just say, I don't know, and continue to do research and continue to, like, take the knowledge that you have and say, okay, let's explore these different avenues, whether it's we send you to someone else or we work on it and workshop it in the office. Yeah.
That's good to know. And what keeps you motivated to, like, keep doing your job every day?
I think just patient testimonies, hearing how people feel, families that come in and they say, we'd be in so much pain without you, or just saying, like, we look forward to this, we feel so much better after we get adjusted, or you helped me get rid of my pain, it was debilitating, and now I can walk with my dog, or now I can go skiing. And that's always so, like, okay, I want to do this for the rest of my life.
It's really nice.
Yeah.
And you, like, run this clinic, right, or this practice?
Yeah.
So what other tasks do you have, like, besides just, like, helping the patients? Like, what are some of your, like, practice tasks?
So when you own a practice, you have to look into getting in network or out of network with certain insurance companies, billing, running staff meetings, running meetings with your bookkeeper, with your accountant, paying the taxes. So when you have a business, you have to pay taxes quarterly. That's not something I ever really knew until I had a business myself. And so it's like all of these little administrative things, ordering supplies, for example, making sure things work, making sure that your staff members get paid, running the payroll. There's so many things. It's a lot of work. Marketing, having meetings with all these people that you delegate out tasks to. It's a lot of work.
How do you balance, like, your busy schedule, and, like, how do you make sure you have time for your personal life?
You make time for the things that you love to do, but at the same time you have to set boundaries, and you have to be really, really focused and diligent with your time. People say, if you want something to get done, you give it to somebody that's busy, because they will get it done, because they are so diligent with their time. So, I could come in here and say, okay, I have 20 notes I need to do, and sit on my phone and not touch a note, right? Versus, okay, I know I've got 15 minutes before this meeting, and then we have patients, I need to get this done, I have a 15-minute window. So really being strict with your time is a big thing. And then setting aside time and setting boundaries and saying, okay, I leave at this time, and that time is my me time, and I get to go on a walk, or I get to go get groceries or do something fun. And then weekends are always, like, my family time. So you dedicate specific time for specific things. Yeah.
That's good. And lastly, what advice would you give to people interested in becoming a chiropractor?
Shadow, do your research, shadow more than one chiropractor, because everyone practices so differently now. And just be a good listener, listen to people, be humble, do good in school. School is tough. Chiropractic school is very all mushed together in such a short span of time. And it's really easy to get into chiropractic school, but it is very difficult to stay in the program. So staying laser focused when you're in school is very important too.
How long is chiropractic school?
It depends on the program you do. So it's between 3.5 to 5 years.
Okay.
Yeah.
After undergrad?
After undergrad, correct.
Okay. And then do you have to, like, do something after that?
There are optional residencies you can do.
Okay.
They're not required at all.
Can you, like, specialize in something?
So there's pediatric chiropractors. There's different like diplomates you can get after you finish school. So for example, with like medical practitioners, some of them are orthopedic doctors, some of them are rheumatologists, right? So chiropractic has similar realms, and it basically consists of a diplomate. So you can get a diplomate in radiology, and you could strictly just read X-rays, MRIs, CT scans, and write the reports for other doctors. You can do pediatrics. You can do neurology. You can do nutrition. There's so many different kinds, but it is additional school. It's another, some programs are like 2 to 3 years on top. Yeah.
Okay. Well, thank you so much for the interview. It was
Of
really nice
course.
learning about your
Yeah.
experiences. Thank you.
You're welcome, Anu.